Hi, class of 2015. I'm Jessica, and my case study is on JS. He's an 86-year-old patient with aphasia and cognitive communication deficits after a head injury. He has a past medical history of diabetes and hypertension. He was admitted into the hospital early 2015 after falling at home and causing a bilateral hematoma. He had craniotomies and evacuations of the bilateral subdural hematomas and was discharged into a rehab nursing facility. Upon his arrival to the rehab nursing facility, he was evaluated with portions of the BDAE, the WOB, and the RIBA. The results were indicative of poor orientation, inability to follow two-step commands, decreased abstract reasoning, decreased comprehension, decreased ability to express wants and needs, decreased automatic speech, decreased ability for repetition and naming. His working memory and short-term memory were the most impaired, and his long-term memory was at 75%. Problem solving was at about 20%. The client has been in therapy for about a month and a half, and he receives therapy 5 times a week for 30 minutes every session. A little bit about aphasia. It's a neurological disorder and communication disorder caused by damaging sections of the brain that target language. The patient with aphasia has difficulty expressing the right word that he wants to express. JS has receptive aphasia, and he can hear a voice or read and print, but he does not understand the meaning of the message all the time. Some of his goals, specifically his long-term goal, would be to improve overall cognitive linguistic skills to a max assist. These are scores based on the FIMS measures. It's to increase independence with ADLs. Some short-term goals to accompany that long-term goal would be to, he will problem solve, monitor, and evaluate solutions in everyday situations. He will select best alternatives or solutions to problems presented with 90% accuracy. He will give appropriate answers to problem-solving questions about ADL situations with 90% accuracy. He will complete problem-solving and reasoning tasks to increase safety in the hospital and home environment. He will express basics needs to increase communication with family and staff, with 50% given min cues. Another long-term goal would be to improve memory skills for key information, environmental information, and day-to-day information with 90% accuracy. The short-term goals that would accompany that will be to complete short-term memory tasks and long-term memory tasks to increase independence with ADLs, and also to complete naming tasks to increase word-finding skills. Patient will also follow two-step commands to increase participation with ADLs. A treatment method would be a word retrieval cueing strategy, which would target an approach using semantic cues and verbal cueing. This approach would be to check first to make sure the patient is alert and oriented, and begin with the patient to recall one word. So let's say you want him to recall hand. So you would show him a hand. And then you would say, okay, I'm going to ask you again to remember the word hand. And then you would tell him some memory aids. For example, say hand 3 times. Hand, hand, hand. And then you would ask him to associate and make a mental picture of that hand, and then ask him again. As a clinician, you want to document the time you asked him, and then at what time you asked him again, to see if you can increase the time or increase the amount of words or pictures given to the patient. Some other treatments or methods would be oral reading for language. This helps in aphasia because you have them using auditory visuals and written cues to assist the person with aphasia in reading sentences out loud. There's also sentence production programs for aphasia. They might have difficulties completing sentences or, just building their own sentences. And this would be to produce specific sentence types. So maybe having them use WH questions or things like that. There's also sequencing, which you would want the patient to recall information, identify key details, and sequence information based on inferences. You could also have the patient role playing, so this would be beneficial for adults and children, but more so in adults in this setting. Have them think about a time where they went to their favorite restaurant and the steps that happen when you walk into the restaurant and how you order and things like that. These are just some of the goals that this patient had and some of the treatment methods, because there's a lot of things to target, and also a lot of methods can be incorporated into one. For example, the sequencing. You can use that as short-term memory, you can use that as problem solving, and a lot of other things. I also wanted to inform you of some therapy tools that I like to use. I like to use a regular deck of cards or Uno cards, and you can recall colors, recall numbers. You can have them adding, so put the deck down one by one, tell them to tell you, okay, when you add to 2, tell me to stop, or things like that. Or when you find an ace, tell me to stop. In the adult world, also, if you're working with dysphagia, which in this case, JS also did have a feeding tube and did have goals for dysphagia. You could use his food tray or her food tray for naming tasks, especially when you are short on time and you need to incorporate your speech therapy with your dysphagia therapy. You can also use coupons, to make activities, and laminate them and have them categorize and do mathematical problems and so on. Also, you can use Spot It, which is a game I found at Walgreens, and the only disadvantage of this game is that I feel like the images might be too small for the elderly population or things like that. Also, some of the images are kind of hard to identify. I provided a link to a Target where you could buy it at Target, and you guys can read up on it. I also found this on eBay and I bought it. I really like it, but I feel like it's very advanced for the patients at my setting. It's a distraction game, so you ask a question and the rules of the game, you read the rules of the game, but you basically ask a question, and depending on the color you get or the number you get, you continue, and then each person gets a number, you put it down, and you have to continue to remember all the numbers that you placed on the deck. So it's a memory game with numbers. Another treatment or therapy tool would be this, which I bought for $1 at Target, and it's a hamburger patty, and it could be used for sequencing and naming and short-term memory and a lot of tasks and functional tasks, because if your patient's going to go home, they need to remember how to make a sandwich or how to cook and things like that. So you basically, the patty, bacon, onions, tomatoes, lettuce, and cheese. And that's basically it. Thank you. Have a good day. Bye.